Today here on Off the Fields, I have the pleasure of sitting here with Bryn Davenport. Bryn, thanks for joining me on Off the Fields today. Yeah, I know it's a Saturday morning, you know, a lot of important football games going on today, but I know that, you know, you're still training and stuff like that, so thanks for taking the time out of your busy schedule. So I want to ask you this. First of all, how are you feeling today?
Good.
Good. When it comes to Dr. Torres, right, how long have you been working with her?
About 3 to 4 years.
Okay, that's really cool. And how did you learn about her and why'd you come to her?
My dad and her have a relationship together. So
Okay.
they knew each other for a long time, and the first time he took me here, it was just on from there.
What other injuries were you also dealing with, or did you come across at some point that you had to?
I fractured my left knee.
So when did that happen?
About 11, when I was 11.
Okay, and that was in football too?
Yeah.
During practice?
Yes, ma'am.
In between time, you were coming to visit Dr. Torres? So what was she helping you with? How was she treating the knee?
Getting my leg back stronger because I wasn't active with it.
If you could talk about your progress, right, from when you got injured, right, up until now, what has improved the most?
After seeing Dr. Torres, my knee, it felt better and I gained my confidence back.
What kind of is unique about Dr. Torres compared to some of the other doctors that you've worked with?
Dr. Torres, she has everything you need to get you better.
Yeah. You know, when it comes to your recommendation, right? Your other teammates, I'm sure they've also worked with Dr. Torres, right?
So this technique that we're going to do now is called soft tissue mobilization with instruments, or Graston technique is the one I use per se. So I'm applying a little bit of lubricant so that I have a little glide on the skin here. So let's say we're treating a quad tendonitis here. What tends to happen with with tendon tissue is that if you have a strain, you're going to start to get a fibrosis. So it's almost a scarring that forms in that tissue. And so when he tries to stretch, it's still too tight, it won't stretch. If he tries to jump or push off, it's going to cause a lot of pain. So with this tool, what we're doing is we're actually breaking up that scar tissue that's formed in that tendon. Any injury that's lasted more than 2 weeks has already formed some fibrosis. So this is very effective. And by breaking up that scar tissue, bringing in blood flow, his range of motion usually improves. His stiffness in trying to push off is going to hurt less. And so a couple injuries I use this for a lot is Achilles tendonitis, like he said, quad tendonitis, patellar tendonitis, hamstrings. It's very effective. So I usually start them here in a semi-stretch position, and then I want him to bend his knee so he puts it on a full stretch and work the tissue in the stretched area. So a common reaction that I get when I bring this out, usually kids freak out, because they're oh, is that gonna hurt, this and that. But once they get used to it, it almost becomes a form of life for them, right? It's kind of just common, and they know that it's gonna give them relief. So a common reaction that I get when I bring this out, usually kids freak out, because they're oh, is that gonna hurt, this and that. But once they get used to it, it almost becomes a form of life for them, right? It's kind of just common, and they know that it's gonna give them relief. It's not gonna hurt. So you always want to apply enough pressure to break up some of the scar tissue so they feel some pressure, but there's no reason to be scraping to cause bruising or to that extent. So I've had athletes that sometimes they came from someone who did that, and that's why they were a little more fearful. And then when I do it, they're like, but it doesn't hurt. It doesn't have to necessarily hurt to be effective. And I don't want to cause a new injury on something I'm trying to take an injury away from. Okay. Good. So I'll bring this down. Good. So I usually go through a couple series of different positions, scraping out. I would also do patellar tendon because it's still a continuation of that same tendon onto the insertion. So working into patellar tendon, put them back on stretch, repeating the same thing.
Would you recommend Dr. Torres, and why?
It really helps a lot. It's when I say first day relief, right after, I can go do anything.
And is there anything else you want the world to know about Dr. Torres that they should know?
Just come check it out.
Yeah.
It'll be better. Trust me.